Welcome to the Advancing Surgical Care podcast, brought to you by ASCA, the Ambulatory Surgery Center Association. ASCA represents the interests of outpatient surgery centers of every specialty and provides advocacy and resources to assist them in providing safe, high-quality, cost-effective patient care. As with all of ASCA's communications, please check to make sure you are listening to or viewing our most up-to-date podcasts and announcements.
Hello and welcome to the Advancing Surgical Care podcast. My name is Bill Prentice. I'm the CEO of ASCA. My guest today is Chris Schriever, the founder of ASC Data, which is the newest affinity partner for ASCA. Many in the ASC community already know Chris and his team for the support they provide to us in the recruitment and management of ASCA's affiliate and sponsorship relationships, especially those that help make our annual conference a great success. ASC Data is a relatively new venture for Chris, and I've asked him to join me for a short discussion about its origins and how the Medicare and industry data he collects is being used by the many companies that support surgery centers. Also, I thought our listeners would benefit from knowing more about the collateral benefits to ASC administrators who interact with sales and marketing professionals every day. Chris, welcome to the podcast.
Thank you, Bill. It's a pleasure to be here.
So I received your most recent ASC data report for the third quarter of 2025, and it was really insightful. But before we talk about the data you're collecting, could you take a moment and share with us what inspired you to start this new business?
Sure. We started talking about the need for something like ASC data during the pandemic. My co-founder, Alex Udall, and I have been in the ASC space for a long time. And when the world shut down, we kept hearing the same thing from vendors. It's impossible to find reliable, real-time data on the ASC market. We'd been building our own data sets for years just to help us understand and navigate the market. We realized that if we could clean that data up a bit, share it, we could help suppliers, investors, and health systems stay connected to the community during that really fragmented time.
That's great. Chris, I have a lot more questions, but before we get to those, we need to take a short break to hear a message from our podcast sponsor. Stand by and we'll be right back.
This recording is being brought to you by Surgery Partners, a leading owner and operator of ambulatory surgery centers with more than 200 locations nationwide. Surgery Partners collaborates with ASC leaders and physicians to acquire, develop, and optimize surgery center operations and helps ASCs scale efficiently, strengthen performance, and drive long-term growth. To learn more, visit surgerypartners.com.
Chris, let's talk about the reports you are producing. How do you distinguish what you are offering from the data generated by the Centers for Medicare and Medicaid Services, or CMS?
Oh, that's a great question. We do start with raw data from the most reputable sources, including CMS, but that's just the raw material. If you've ever looked at a CMS file, it's quite a puzzle with a key that will have you scratching your head. What sets us apart is the human layer. Between Alex and me, we have nearly 40 years of combined experience in the ASC market. We don't just run an algorithm, we apply our industry knowledge to catch inaccuracies and restructure the information in the way it's being used by our various subscribers. We break it down by corporate affiliations, specialty mixes, and even the number of ORs. We turn a massive spreadsheet into a strategic roadmap that you can actually use the day you download it.
Yeah, I can say that having looked at your report, you do take what is fairly unintelligible data from the government and make it really clear and clean, creating that market intelligence that can help folks navigate the ASC business and really understand where things are growing, where things are contracting. So let's talk about that. What are a few of the key findings or trend lines that stand out for you in, say, the most recent report?
Well, thank you, Bill. I'm glad you recognized that. It was a challenge to get it started. I think the biggest story right now is complexity. For years, people thought of ASCs for simple procedures, but our data shows a massive migration of high acuity cases like total joint replacements, spinal fusions, and angioplasties. Because of that, we're seeing the physical footprint of ASCs changing. The number of ORs per facility is increasing to handle that volume. Specifically, we're seeing explosive growth in orthopedics, pain management, and cardiovascular. With over 30 new cardio codes added recently, the shift from office-based labs to full-scale ASCs is a trend that isn't slowing down.
Yeah, and that's where I think I find this data really fascinating because we obviously work very hard at ASCA through our advocacy, trying to grow the number of procedures, give more opportunities for surgeons to do more. And what ASC data shows is actually how that's being actualized, that it's actually occurring. And so it's really gratifying to see that our advocacy is actually resulting in growth in the ASC market and the ability of surgery centers to expand their service lines.
That's for sure.
So let's talk about applications. So who is the typical end user of your ASC data, and how are they putting it to practical use today? And how can they use it strategically to plan for the future?
Sure. Our typical users are healthcare suppliers, consultants, and investors, basically those that support the operations of a surgery center. For starters, ASC data is relied on for identifying new leads, tracking physical or specialty growth at the facility level, and tracking corporate expansion. Moving beyond that, our subscribers also use our data and insights for strategic planning. If you're a health system or an investor, you need to know where the desert and the oasis are. Our data helps them see where the market is saturated and where there's an opportunity.
Yeah, I think that's well stated. I think using this data and just using it as a snapshot, but I was looking at it quarter after quarter, year after year, you're not only seeing where the market is, you can project where the market's going, which I think is so valuable to a lot of the vendors in our space that want to get ahead of knowing what the needs of our surgery centers are going to be down the road.
Yes, Phil, you're speaking to our year in review, which we're about to release here, which will take a look at the entire year and exactly that, those trends that we've seen and where we think things are going based on all of the factors in the market today.
Great. So, Chris, in my intro, I mentioned that you believe this data and service can also provide a collateral benefit to individual ASCs as well, not just our vendors. Can you explain how an ASC leader might benefit?
This is something I'm really passionate about. When a sales or marketing professional has better data, they approach an ASC in a more helpful way. Instead of a rep walking in cold and asking to be told about a facility, they show up knowing the specialty mix, the OR count, and the specific needs of that facility. It makes the interaction more efficient and more respectful. We're essentially helping those that sell to the ASC community speak the same language so that surgery centers get approached with solutions they need in the most helpful way possible. How great is that?
That is great. It's one of the things that actually really piqued my interest in creating this affiliate relationship with ASC Data, not only just because it's a great product, but I see value to our members in that if it makes the vendors and the people that are trying to sell products and services to our surgery centers smarter and more knowledgeable about the center itself, it's going to improve that relationship and probably result in less wasted time and dead-end calls to our administrators and other key leaders in surgery centers.
That's the goal.
Well, that's great. Chris, last question. How does anyone interested in learning more about ASC Data get in touch with you?
The best way is to head over to our website at ascdata.com. You can see samples of our quarterly reports, request a sample of the data, or grab some time in my calendar, and I will gladly walk through the data and the reports with you. And for ASCA members, we do offer a discount.
Oh, that's awesome. And also, I will tell ASCA members that you will routinely be seeing data points from ASC Data, both on the ASCA website and the future ASC Focus articles.
I'm very excited about that. We have a lot to tell and happy to be sharing it with the ASC community.
Great. So, Chris, thanks for spending a few minutes with me today, and thanks for all you do on behalf of ASCA and our affiliates and sponsors.
It's truly my pleasure, Bill.
Now, before concluding, I would once again like to acknowledge the support of our podcast sponsor, Surgery Partners, a leading owner and operator of ambulatory surgery centers with more than 200 locations nationwide. Surgery Partners collaborates with ASC leaders and physicians to acquire, develop, and optimize surgery center operations and helps ASCs scale efficiently, strengthen performance, and drive long-term growth. To learn more, visit surgerypartners.com.